graded exposure as a kind of process is something which is a feature of all sorts of different kinds of intervention.
I think it's generally common for people to be a bit afraid when they come to the doctor, especially when they have some test, blood tests or vaccines, and that's not different for people with a learning disability.
Previously, I didn't know what graded exposure was. I then understood following a meeting with professionals that it was an evidence-based treatment that works gradually, so it kind of like breaks it down in steps and is something that staff could support in a safe and controlled way.
People having had difficult experiences in the past, maybe where they weren't told exactly what was going to be happening, things were quite unexpected, maybe instances in which healthcare has had to be delivered quite quickly, people don't get the chance to know what's going to be happening, and that can leave them with some distressed feelings around the idea of going back for a blood test or something like that.
I had some medical problems with James. We had to take him to A&E because he was in a situation where he was frightened of and he'd been traumatised by previously. He wouldn't let the medics examine him. So they had to resort to stabbing him in the legs with ketamine so he could subdue him, basically. We needed to address that because if he had to go back to hospital, we're going to have the same situation all over again.
So in terms of what makes graded exposure effective, I mean, it's worth saying, I suppose, that the NICE guidelines, which are our kind of go-to, recommend this kind of approach for people who have a learning disability, autistic people, who are experiencing phobias, who are experiencing anxiety.
Some people have a needle phobia with or without a learning disability, and that means they have an extreme fear of having injections or having bloods taken.
Our natural response when we encounter something that makes us feel anxious is to move away from it, that aversion response. So what our brain will remember is that really strong, overwhelming sense of anxiety, that physical response that we're experiencing. And next time we encounter that thing, our brains will think, oh, I shouldn't be going near that situation because I might encounter that thing. And last time I felt really scared. And the time before that I felt really scared.
Some people just don't want to see the needle. Everything else is absolutely fine. And as long as we're a bit sneaky, it works perfectly well. Some people don't want to see the blood, so they look away. So it's just really talking them through. Often it is relatively simple things that make the biggest difference.
So a really good example might be somebody who's working on their phobia of needles, that you've gone from perhaps the level below, which might be having what we call a fake syringe that's got maybe fishing wire in the top, something that you can press against someone's skin that gives that feeling of pressure, but isn't obviously a real needle. Often, that shift up to there being a real needle even in the room is something which is a bit of a shift for that person. So often we really need to slow that process down, maybe do what we call a social story, a simple breakdown of what the process is going to be that might have images on it, and we'll just talk them through and we'll think about, well, let's maybe have the needle in the room, but it's far away, it's going to stay, no one's going to be touching it, it's on the far side of the room, and we're just going to spend some time in that space.
I think you push yourself.
Yes.
Because you know the needles were a problem as well. The whole thing was a problem, but like you will look at the needle, won't you? And you will sort of, it's in a packet, but you'll handle it and look at it, won't you? To get used to the idea of seeing a needle, don't you?
Yeah.
If someone is being supported in the right way around these kinds of graded exposure sessions, the brain is really good at learning that things are safe. Once they get the first couple of sessions done, they get this feeling of confidence, they're feeling empowered, they're feeling that they're able to do something that they previously weren't able to do. There's a huge sense of pride for somebody there. And it's so rewarding, I think, to see that sense of pride for them and how proud they feel at being able to take control of something which actually for a long time has caused them a huge amount of distress.
You're led by James, really. You can see when he's had enough, or he's finding an aspect difficult, and then you just back off a bit, but you don't stop.
So we looked at things that would help you.
Oh, and the music.
Yeah.
Yeah, because you're carrying your phone.
Yeah, so you have a
usually.
phone and you choose what music you're going to have, don't you?
Yes, yeah.
And we don't keep it to the same as you do sometimes in a plan. You choose what you feel like that day, don't you?
Yes, I should do something different.
Yeah.
He's just done so well, and continuing to surprise us and do things, you know.
It's been fun, actually, making sure. So.
It's not work, is it?
No, it doesn't work.
It is gradual, You don't notice the effect at the time you're doing it. It's only when you look back over time and you can see the changes in that's happened.
Do you think that you're getting nearer to having that blood test
Yes.
with this plan?
Yes.
As a healthcare professional, I think it's probably one of the most rewarding bits of work I get to do, so I always really look forward to doing that.
Just take it incrementally, step by step, and it does work. Well, it does work.